Ladies and gentlemen, dear colleagues, my name is Peeter Ross. I'm an eHealth specialist. I'm radiologist and also eHealth professor in Tallinn, Estonia. I have been one of the designers and developers of a well-known Estonian eHealth system some 2 decades ago. Today I will give you overview of the eHealth situation in Ukraine. And let me just start with my slides. So here we go. This work about eHealth in Ukraine is done with cooperation with MURC and Estonian e-Governance Academy. I'm personally additional to e-Governance Academy, working also as a professor of eHealth in Tallinn University of Technology and radiologist in the East Tallinn Central Hospital. And I'm also consulting around 15 countries about the large-scale eHealth implementations through World Bank, Asian Development Bank, and the German Development Bank, KfW. This is the content of this presentation today. Just a few words about e-Governance Academy in the beginning, then I will open some eHealth terminology just to have all of us on the same domain to understand the terms in similar way. Because eHealth is really a wide domain. Then a few words about eHealth in Europe, because Ukraine is in Europe, and it makes sense to compare Ukraine also other European countries. And then I'm going to more specifically to Ukrainian eHealth development, current situation, and opportunities what there are. E-Governance Academy is Estonian non-governmental, non-for-profit and non-academic institution which is promoting and helping implementation of different e-governance services. And here you see the reach of Academy, so we have really a wide network in the world. Now about eHealth terminology. And I have taken OECD terms, and they divide eHealth into 4 categories. It's electronic health record, health information exchange platform, telehealth, and personal health records. So EHR is an application what is used by healthcare professionals in their workplace. So this is the software where nurses and doctors are collecting the data about the person's health. Health information exchange is communication of this data between different healthcare providers. So if my hospital has electronic health record, then to exchange the data in the electronic health record of my hospital with another hospital, we have to use health information exchange platform. Telehealth is a technology that is beyond of the EHR and IHE. So this is the tool to provide service from distance. And there are really several applications. And personal health record or also known as patient-centric electronic records or patient portals. They are applications for the person to get access their health data, what is collected by healthcare professionals through EHR or other tools. So this terminology is important because if you think about later on about the opportunities in Ukraine, then each of these domains have their own pros and cons. Now let's look how digital data is used in healthcare. And this is as complicated as the previous slide. So even though we collect the data about the person's health, the use of this data is divided into several domains. And all these domains usually have their own softwares, their own operational logic, and also own governance. So, and here are 5 main domains. So first of all is provision of healthcare services. So this is operational data. This is what we have in hospitals for patient treatment. And here comes in also term electronic medical record or electronic patient record. These are synonyms basically, but these are the softwares which are located in the healthcare institutions. And also radiology information systems, laboratory information systems, picture archiving and communication systems. So all softwares and applications what are needed for patient diagnosis and treatment. Then next one is data used for healthcare institution management. This data is for hospital managers. And this includes business intelligence, performance indicators, health management information systems, and other non-clinical systems. So it's also used in hospital, but totally for different purposes. It's not for the treatment, but the healthcare institution management. Then third domain is health data analytics of the region or country. This data is about research, reporting, public health. And this gives for the policymakers information about disease prevalence, health indicators, disease registers. And this data is not collected by doctors or nurses during their treat or care process, but this data is collected afterwards by statisticians or other specialists from the electronic medical records or other records in hospital. Fourth domain is for healthcare policy making, to plan services, to make decisions where to locate hospitals, where should be primary care, where hospital care. So this data is for government and local authorities. And this is also aggregated data. And finally, health care financing, different insurances, payers. And again, even though this data stem from the patient care, these information systems are separate to electronic medical records. So, as you see, the landscape is diverse. And if we think about Ukraine, and if you look how Ukraine's e-health is built, then actually we will later see that most of the e-health is built around insurance, health insurance. But about in more detail, we will discuss later today. Now I jump to Europe and look what is the situation and what data are exchanged in eHealth in Europe mostly. The most recent survey that has been done is from 2018, and this is about general practitioners' use of eHealth. It analyzes 27 EU member states, and the level of the eHealth adoption is diverse. So Denmark, Estonia, Finland, Spain, Sweden, they are ranking high, and others. Here are also some countries where a lot of should be done. But overall findings, and now if you think back about this terminology, overall findings are that vast majority of healthcare providers are using electronic health records, while health information exchange between the GPs and hospitals is lower, but it's improving. Also, telehealth adoption is progressing, but access of the person's access to their own health data is overall low. And let's see what kind of data is exchanged in Europe mostly. If you talk about the electronic medical data, EHR, then you see that top rank of the data, electronic data, are diagnosis, lab test results, medical history, basic medical parameters. So it's about clinical data. And then the financing, billing, some radiology images, different interaction decision supports, they are not used widely. So this is in the GP's practice. And if you look at the exchange of the data between healthcare institutions, then top ranking is for lab test reports, which is obvious because GPs are sending their patients to have lab tests in other institutions, and then they receive back the tests. Then the second is sick leave certificates, which is now different from the previous slide because this is not about the medical data but administrative data. And then here are following prescriptions, referral letters, patient appointments, requests, and so on. Also, if you think about Ukraine, then these are obviously the first steps what in eHealth should be adopted. How this works today, we will see later. Now we are in the main content of today's presentation, Ukraine. Ukraine is a big country. This map on the upper right corner represents different regions. The population is, the figures are different. It varies between 41.5 to 44.5 million. It depends if you count Crimea and also East Ukraine regions or not. But the area is huge, so compared to Japan or Estonia, the geographical dimensions are completely different. The eHealth in Ukraine has its history, but it hasn't been developed systematically yet. So there are a lot of international development partners which have supported Ukraine with development of different digital tools. World Bank, USAID, Global Fund, WHO, they all have put quite a lot resources into Ukraine. However, all these, most of these investments have been occasional, not so systematic, and usually when the program ends, also the service ends. But in 2017, Ukraine, the government of Ukraine initiated really a very bold reform. They decided to change healthcare financing from the old Soviet so-called Semashko model, which was payment of medical services through central budget. They decided to change it to the funding system where money will follow the patient principle. It's pretty similar idea as in UK, or also we can compare it with health insurance in Japan. So the overarching goal was to introduce universally accessible healthcare system that will ensure availability of publicly guaranteed set of primary care and specialist healthcare services in Ukraine. Really, the reform is very, very important to ensure that all citizens in Ukraine will get equal and accessible healthcare. Beyond of this reform, the goals also, or the goals of this reform are that there will be essential medical products which will be paid through insurance. And to conduct the reform, the government established the National Health Service of Ukraine. So it's a central authority which collects resources to reimburse healthcare services in Ukraine. And NHSU, so this insurance, public insurance, single public payer in Ukraine, they by law can buy health services both from governmental and private healthcare providers. So if the hospital has proved that they provide high quality health services, they will have a contract with NHSU, and their services will be reimbursed by the insurance. Then why and how this is connected to healthcare digitalization. Parallel to this financial reform, the government of Ukraine also decided that to ensure efficiency and transparency of healthcare system, there should be e-health system which will support these goals. So And this is pretty different from other countries where healthcare digitalization stem from the medical purposes. First of all, electronic health records to support patient diagnosis and treatment in GP offices and hospitals. In Ukraine, the initiative comes from insurance, and the initial functions are to exchange claims rather than patient data. Healthcare digitalization in Ukraine has a long history. Ukraine has a lot of talented IT people. They have a very good technical education system still. Electronic medical records in hospitals and outpatient clinics emerged already in 1990s. By the way, if you are in Ukraine, then term in English electronic medical record or hospital information system in Ukraine, this term is medical information system. So if we talk about softwares and applications in hospitals or healthcare or primary healthcare centers, then they say MIS, medical information system. And historically, also some specialty information systems were developed, like laboratory information systems and others. And today, there are several high-quality medical IT companies that developing and maintaining medical information systems of healthcare providers in Ukraine. There are today more than 40 companies which are listed by the National Health Service or accredited as softwares which are allowed to communicate and be integrated with eHealth system. Then besides of medical data, I also would like to address healthcare statistics, because this is a completely different data stream. So as we discussed in the beginning of this presentation, this statistical data is provided by the statisticians of hospitals, not by the healthcare professionals or by doctors and nurses. This responsibility lays on the Ministry of Health instead of NHSU. So they collect statistical data from the regional offices of the Center of Medical Statistics. And this Center of Medical Statistics is responsible for collection, processing, and analysis of statistical information on health status, provision of medical care to the population, and healthcare resources, also development and implementation of statistical methodology based on different methods, and ensuring the reliability, objectivity, efficiency, and integrity of statistical information. But this is important to understand that this is completely different data flow from compared to the eHealth system. So if someone would like to act in this domain, then the main partner is not NHSU but Ministry of Health. And this is especially important nowadays because of the coronavirus pandemics. And here is an example of the National Security and Defense Council of Ukraine website. And this is today's morning screenshot showing online information about the COVID situation in Ukraine and in the world. And it goes down to the regions, and this online graph, for instance, is about the number and percentage of occupied beds in Ukraine for COVID, potentially for COVID patients. So you see also additionally to NHSU, to insurance e-health systems, there are also other authorities what are developing healthcare related digital services. A few words about the legal background, how this e-health system is established in Ukraine. So the main legal regulative act for the public medical services, but also for the e-health is the law of Ukraine on state financial guarantees of public medical services, and it's adopted in 2017. And among of other strategic dimensions of this law, it gives also mandate for e-health implementation. So, as I told formally, then it's quite unusual, quite weird that law of the health insurance also regulates e-health. And from my opinion, I have been working in Ukraine several years, more than 5 years so far, and I would say that this kind of approach has put some limits to the e-health development in Ukraine, because the health care digitalization is not looked as a general aim of Ukraine, but and also include public and private institutions equally, but it's about the insured healthcare institutions. So the current system is more an instrument of insurance for healthcare service purchasing and reimbursement of certain medicines, rather than exchange of patient-related diagnosis and treatment data. And even more, all the e-health development has started before the e-health strategy of Ukraine or roadmap has been approved, and it's still pending. So the concept of e-health is approved by the government, but still the roadmap how to implement e-health is not there. How the electronic healthcare system looks like in Ukraine. So even though it's a huge country, especially by geography, but also more than 40 million inhabitants. Even this is so, they have decided to have only one central database for electronic healthcare system, and then this one central database is integrated with these MISs, electronic medical information systems of healthcare providers. There is API between central database and MIS, so every licensed MIS provider can connect with the electronic healthcare system, central database. And the administrator of central database is State Enterprise Electronic Health, but the owner of CDB is state, and it acts through NHSU. There is a triangle: Ministry of Health, NHSU, and Electronic Health, and they all are public institutions. Then medical information systems, they are provided by private companies, and they are tools to populate central database with the data. The background of this central database is that the system was developed by the international donors, so, mainly by USAID, and again, as I told formerly, it's developed without any strategy, without any larger vision, and this central database then was taken over by the government of Ukraine, and for that this State Enterprise of Electronic Health was established. And this is to illustrate, this is quite generic eHealth architecture of Ukraine. So on the left side, we see several central registries. They are digital registries. In this regard, Ukraine is pretty advanced. So NHSU or Ministry of Health, they have their central databases, registries, what are connected through the API with healthcare providers. So central database administrator is State Enterprise Electronic Health, but the owner of the central database is state. And state acting through the NHSU. Then the eHealth system in the future will be connected through Trembita, which is a secure data exchange layer provided by the state, with other governmental registries and databases, and also state web portal, which is called DIA, and which is the portal for patients to access their medical data. Also, this will be in the future connected through the Trembita. But today, there are the main source of digital data to the central database is MIS, Medical Information System. So they are private medical IT development companies which are owning them, and different hospitals have different MISs, and then they send from healthcare providers some defined data to the central database. But really, please keep in mind that these connected institutions are only those which have a contract with the National Health Service of Ukraine. So all other institutions are excluded from the eHealth system, which is a really drawback of the system. And then there are several state registers which in the future potentially could be integrated with the eHealth system. What is not decided yet is medical picture archiving and communication system. There is a huge need for that in Ukraine. There are some occasional implementations, but knowing also that in Japan this technology is very advanced, then I clearly see a potential of implementing PACS applications in Ukraine. This is a screenshot from the website of State Enterprise Electronic Health. So this is the enterprise what runs central database, and this table shows it's in Ukrainian, but it shows on the left side these names in blue. They are different medical information systems, and then horizontal axis here are services what these electronic medical information systems are providing. So, for instance, this first Dnipro MT, they are able to send declarations, medical notes, immunization data, e-prescription, e-referral, then different administrative data, and also claims. They are not able to send, for instance, here some kind of information about e-prescription. So, and you see different MIS providers have different functionalities, and based on their capability to exchange different data, they are approved by the central database owner, and they can then integrate their customers with the central database. So this was overview of the eHealth system in Ukraine. I hope I gave your understanding that the system is in the emerging phase yet, so it's by far mature. There are a lot to do. Digitalization covers still in Ukraine only part of healthcare institutions, and by law mainly the institutions what have contract with health insurance, this single public payer of health services. So clearly there is a lot of room for capacity building, the sharing of Japanese healthcare and medical knowledge, healthcare digitalization knowledge, to improve Ministry of Health and NHSU capacity. There is a continuous need for high quality hardware, which is also asset of Japan. The technology you have is a very, very high quality, reliable. If you think about different software applications which need high quality hardware, then there is a continuous lack of medical equipment which provides digital data, like laboratory information systems, different radiology equipment, also laboratory equipment, like digital X-rays, MRI, others, endoscopies. And there is a high demand for large-scale PACS, and it's not it can't be only one PACS, but I would vision that every region should have their own. However, to do business in healthcare in Ukraine, it has its own specialties. You need to be present. There are a lot of personal relations to get a trust of the customer. The country is highly corrupted, so there are some difficulties to get the contracts. So you have to be present there, understand the situation, and try to step by step start the business. With that, I would like to thank you for interest, and I'm happy to answer any questions by email if there will be any. Thank you very much.